Most therapists think building a business means scrambling to find patients, posting on social media every day, or opening a clinic with massive overhead. That's not what I did. I left outpatient with zero home health experience, built a home health therapy company that collected over $13 million, and used it to transition completely out of patient care and into a true owner role. And the reason I'm making this video is simple. There's a lot of confusion around how the home health therapy business model actually works. So in the next few minutes, I'm going to break it down clearly and simply. No fluff, no hype, so you can really decide if this model fits the business and the lifestyle that you want. So here's what I'll cover: how we get patients, how we get paid without billing Medicare and insurance, how the contracting process works, and how hiring works. Now, quick disclaimer, we're building a real business, so it's not easy. But the reason I love the model is because it's simple, and simplicity scales, complexity fails. And I'll do other videos going deep on why the home health therapy model is so much simpler to scale than outpatient, virtual, cash, and mobile outpatient Medicare Part B. But in general, if you're a therapist looking for consistent patient referrals, almost no monthly overhead, very little startup capital, ease of scaling, the ability to step out of the field, and high reimbursement, this model checks all those boxes. Now let's start with the biggest difference, which is patient acquisition. So this is going to be your therapy company. In most therapy business models, you're forced to hunt down patients one at a time, dropping donuts at doctors' offices, stretching people for free at gyms on your weekends, or posting on social media every single day and cold DMing people. It's exhausting and it's slow. Home health works differently. So in this model, we partner with home health agencies. They handle doctor and hospital relationships, all the marketing, and the referrals. We don't. We simply sign contracts with them. When they have patients who need PT, OT, or speech therapy, they send us those patients directly to our company for either you or your therapist to treat. Now here's the part that most people miss. In many markets, there are hundreds or even thousands of agencies, but only a small percentage of those actually have a lot of volume, serve your specific geographic area, and are worth contracting with. So for example, in California alone, there are over 2,800 Medicare certified agencies and even more that aren't certified. Signing contracts blindly is a great way to waste months or years. That's why you cannot rely on Google or Indeed to find the right agencies. I found a secret way to identify both the size of an agency, meaning how many patients they have on service, as well as the location of those patients down to the zip code. And that's how my company ended up contracting with over 300 home health agencies, because early on I figured out how to identify the right ones. And this is the very first thing I do with my clients. We meet one-on-one and I build a list of the exact agencies they should contract with. That's how you get patients fast. Now, one important concept here: most companies grow vertically, meaning one agency with more patients. And that's fine, but you must also grow horizontally, meaning more agencies. Why? Because diversification of referral sources is what creates stability. If 90% of your referrals come from just one agency and something happens to that agency, your business is done. And when I first worked with the owners of Forge Rehabilitation, they were doing about $20,000 a month, and 95% of their referrals came from just one agency. It was extremely risky. So we focused on adding more agencies, going from 2 to 14. And as a result, revenue increased 700% from $20,000 a month to $140,000 a month. And their company gained significant stability for both the owners and their staff of therapists. And I'll link the interview I did with them at the end of this video. Now you see the front end of how we acquire patients with the home health therapy model. We find the right agencies that have tons of patients where we and our therapists want to treat. We contract them and they send us patients without us having to post on social media and spending our afternoons banging on doors to cater lunches for doctors that aren't interested in talking with us. Now, one key thing to understand: if an agency receives a patient referral for, let's say, nursing, PT, OT, and SLP, and they're missing even one discipline, they cannot accept the patient. And each patient is worth thousands of dollars to them. We solve a critical money problem for the agencies. Doctors, on the other hand, don't get paid for referring to you. In fact, it'd be illegal. Now, let agencies do the lunches and the marketing. They have bigger budgets and more time. You just need to know which agencies to partner with. And that's patient acquisition. Now we'll talk about our second topic, billing. And this part is refreshingly simple. Unlike outpatient or mobile Medicare Part B, we do not credential. The company or individual therapist. We let the agency handle all the complicated Medicare and insurance, credentialing, and billing. We operate as a business-to-business partnership. We invoice agencies a flat rate per visit paid in 7, 14, or 30 days, depending on the terms of our contract. And that's it. For context, my company ran mobile Medicare Part B for 2 years. We paid 7% of revenue, not profit, to a billing company, waited longer to get paid, and dealt with credentialing and tons of other headaches, and it really crushed our profit. That's why we killed that department and doubled down on home health, because it was simpler and more scalable. Now let's talk about our third topic, contracting. And for clarity, we don't contract with Medicare or insurances. We contract with agencies. There are just 2 ways to do this. Option 1 is to use their contract. It's simple, free, and is totally fine early on. The downside is they'll know you're a smaller and less experienced company, so they're gonna offer lower rates. Also, there's going to be different terms with every agency, so it really becomes kind of a nightmare to remember invoice days, which days you'll get paid, and protocols outlined in every contract, because each one is going to be drastically different. Finally, although most agencies will have a contract to send you, not all will. The second option is use your own contract. Now, if you do this, there will be the same terms with every agency, which makes way cleaner operations, way easier to scale, higher perceived credibility, and you'll be able to get a lot higher rates. Now, the downside is the expense to creating your own contracts. This is the only big expense to starting a home health therapy company. And many of my clients were spending $7,000 to $8,000 to have lawyers write contracts for them. So I hired a home health specialty law firm, and I had them create a contract to partner with agencies, a contract for recruiting therapists, and a business associate agreement. I spent over $9,000 to have that home health specialty law firm write those 3 contracts, so my clients won't have to. Now, our fourth and final topic is hiring. And this part scares a lot of therapists, but again, it's simple. Most businesses hire therapists as W-2 employees, and that means payroll taxes, workers' compensation, paid time off, health insurance, payroll services, retirement plans. It's expensive and it's complex. So with this model, we hire 1099 independent contractors. We sign an independent contractor agreement, we pay per visit, and that's it. My company hired over 650 therapists. Recruiting is a major reason companies scale, and it's something I work heavily on with my clients. Forge Rehabilitation, for example, grew from 26 to over 100 therapists while I worked with them. So let's put it all together here back at the whiteboard. So the agency gets the referral, they call your company, you send out your therapist. That's a car. The patient gets treated, and although each market rates differs, here's an example. The agency pays the company $120. The company pays the therapist $60. And so there's a company profit of $60 a visit. The patient gets great care. The therapist gets paid more than they would in any other setting. The agencies can accept the patient and make money. And because we don't need to rent an office and buy expensive equipment, your business has very little overhead eating away at your visit. That profit is what allows you to step out of patient care or make serious extra income if you want to keep treating. If this clarified the home health therapy business model for you, hit like and subscribe. I've got a lot more free training videos coming. And if this model aligns with the business and lifestyle that you want to build, there's a link below to book a free one-on-one strategy session. We'll dive into what it is that you're trying to achieve, and if it sounds like something I can help with, we can go through the details of my home health accelerator and what it would look like to partner up.